Just take a look at yourself. Do you really think it's gonna help if you always fighting yourself, trying to forget how you felt? Just take a look at yourself.
Hey guys, it's Caro. Welcome to my channel. If you're new, my name is Carolina, and today I'm gonna talk about my 1 year update being in Telemetry RN. I haven't updated you guys in a while, and it's about time I start uploading videos on YouTube and getting serious about this. I have been a Telemetry RN for a year now, and it's been, if you guys saw my orientation videos, you guys saw how excited I was and how like yippee I was, especially after John had passed away. I was just in my emotions and grieving, obviously, but it was something that I was looking forward to as a distraction too. And then finally starting my career in the hospital, I was so excited. Okay, so if you guys didn't know, I did sign a contract with an agency to start working at a hospital near me, at a telemetry unit. So the contract is a 2-year contract, and I'm not going to disclose agency names or the hospital that I'm working at. I'm not sure if you guys follow me on Instagram, like you guys probably know what hospital, or if you're from the LA area, like you probably know what hospital I work at, but I'm not gonna like talk too much about the hospital or the agency because I'm still in the trenches. So I just want to talk about like my experience, obviously a little bit about the hospital because my experience is I work at that hospital, so my experience has to do with the hospital, but I'm not gonna so I don't want what I talk about to come off as like I'm bashing the hospital or anything, or if like I changed my mind. I'm a very positive person, so even when shit goes south, like I try not to complain. Like I'll complain in my personal life, like with people, with my friends, or like maybe a little bit with my mom, and then like my now boo thing or other friends that are nurses, but I'm not gonna sit here and complain to you guys or anything bad that I have to say or anything, because I feel like everybody, no matter where you go, like you got something like negative to say, but that's not what I'm here for, like, because the overall is, well, at least my overall is, I take everything as a learning experience. So, okay, so telemetry nursing, it's kind of like med-surg a little bit, but you have like 4 patients instead of 5, and you focus on the heart. So a lot of like heart conditions. We do get patients who come in with diabetes and other health conditions, but we focus on the heart. And obviously if you're on the telemetry floor, we have to monitor your heart. So we did have courses that taught us how to read EKGs, or the heart rhythms, different heart rhythms, and what they say and what they mean. So I still suck at it. It's something that I'm still trying to perfect, like not perfect, but I'm still trying to learn like what specific heart rhythms look like on the monitor. And then there are some that are more rare than others. So a normal sinus rhythm obviously is like straightforward, so that is obvious, but like anything like AFib or atrial fibrillation or anything like that is a little more tricky, like for me personally. So it's still something that I still have to constantly study, and I've been sucking at it because this whole year it's like I've been trying to work and learn a lot of new things, but also grieve and be there for my children, and then it's been a lot, but I enjoy it. The people, my preceptor, the girl that precepted me, she was really good, but then she only precepted me. My whole preceptorship, my whole orientation, after the whole 2 weeks of the orientation in the beginning, I was with my preceptor for like 6 weeks before I can like be on my own. Really fast, especially in this hospital. But I had to be on my toes and learn quick because yeah. So like there was a lot of like times where there was not, I mean, my preceptor was great, but she only precepted me for three weeks. Then she had to go. She didn't leave the hospital, she went on vacation. But I was precepted by other people, different people in the unit. And it was just, I learned from each preceptor. Preceptor. And some of the preceptors, like, they had not been there for years. Like, they were new. Like, not new. Well, less than a year, I guess it's still considered new grad, but they had been there a little longer than I had. So even when I was precepted, like, by them, I learned a lot. So, I have birds. I'm sorry. They're noisy. But anyways, there are times where I have been very stressful because in the beginning, I would say that I feel like the first 3 months were the most stressful for me. But because everything that I was going through at home, like, to me, like, going to the hospital and working was not a stress reliever, but it was distracting for me. So I did enjoy going to the hospital and taking my mind off of everything that I was going through at home and just my emotions. I did, in the beginning, it was mostly trying to learn how to do everything during the shift. So obviously take care of the patient and chart. And just kind of getting my own rhythm in how to take care of the patient. So what I was gonna do first, prioritizing basically. So I still, like, now I feel like I am good at prioritizing what to do first and not leave that, like, stay after extra time, because my agency is a little strict on staying after your shift, after the 12 hours, because I don't know, but they have this thing like, well, oh, yeah, I don't want to talk about that. Anyways, so I try not to stay late. In the beginning, the latest time that I stayed, it wasn't like every day, but in the beginning, I felt like most of the time I would leave like at past 8:30. So the shift started at 7 p.m. and I would leave the hospital to finish, last minute things that I didn't get to chart, like at 9:30, 10. And it wasn't every day, but it was just something that I was learning. I didn't know how to prioritize, like, what to do first, what patient to see first. If a patient is in pain and then you get another one that's like, needs a blood transfusion, like how do you prioritize that? And there's like another patient who's yelling at the top of their lungs. And I feel like at my hospital, like, we are a tele floor, but my hospital has a lot of mental health, I feel like. So because there isn't a specialized unit for mental health, I feel like we deal with a lot of that. And I don't think it's just my hospital. I don't know. I've never worked at another hospital, but yes, it can get a little hectic. And so, but I feel like, at least I was told by my preceptor and other nurses there, that I pick up things really quick, that I learn really fast. And that's something that I had doubted in myself. Like, I was like, man, like, I'm gonna be slow. And especially with everything that had happened, like, like, the agency that I am working with, they had offered me to work ED, ICU, or DOU, which is a step down from, like, ICU, or telemetry, med-surg, or rehab. And I chose telemetry because I didn't want med-surg, which telemetry is kind of like med-surg. It was very similar, but I just didn't want the extra patient. So I chose telemetry because I felt like it was going to be not slower. It was just less critical patients, less critical, everything. So I was like, what, like, with my mental state, not my mental state, but, my emotional well-being, I don't want to take up, critical patients. So I went with telemetry, and I feel like I have learned so much in this year. And the people that I work with, like, some people could be like to themselves and kind of rude, like, but I don't pay attention to that. Like, I really am not there to make any friends. Like, yeah, it's nice when you get along with coworkers, but to be honest, like, I can care less if people want to talk to me or not. I'm there to do my job. I have, I do get along with most of the people that I work with, and a lot of people, even the new people, like, they tend to come to me for questions, and I'm like, because I don't know, I guess it's just something about me, like, people find very positive, or like, I've always gotten this since I was a kid, like, oh, like, you're very easy to talk to, or like, I love that you listen to me, like, I feel like you listen to me. So I feel like I'm very approachable, and so, like, a lot of people, like, even before my year, like, found it easy. Like, a lot of people come to me for help, like, when they're new on the unit. And I think that's something that I enjoy, because I'm like, damn, when I was new, like, not everybody was approachable, but even when they weren't, like, I'm not afraid to ask questions, even if you think, like, I'm stupid, or, because there's a lot of times that I've dealt with that, where, like, they're like, oh, like, well, like, just, like, you should know that. But it's like, it's not often, and, I just brush it off. I just tell them straight up, like, no, I don't know that. Or, I do know it, I just wanted to make sure and be comfortable. And don't be afraid to do that. Because, it's, your patient's life and your license. So, even when I'm in a rush or there's, like, an emergency. In this whole year, I've only called 1 rapid response on my patients and 1 code blue. And the rapid response was not, it wasn't, the patient was declining, but it wasn't like, I was super stressed out. And I do make my own brain. Maybe I'll make another video of how I make my brain. It doesn't have to be exactly the same. This is just a brain, like a sheet of paper that I fold in half and have, like, my patient's information, medications that I have to give, and things I have to do throughout the shift. It just helps me keep everything in one page. And if the doctor comes with some questions, I have it on hand. I carry my brain with me throughout the whole unit on the shift, because if something pops up, like, I don't want to, like, think at the top of my brain, like, oh, what was the patient here for? Stuff like that. But I'll do another video on how I do my brain and how I stay organized during my shift, with, like, each patient information and stuff like that. Definitely it has helped me stay on track with, like, prioritizing and stuff like that. So I'm not lost. I don't like to keep everything memorized, or think that I can remember everything, because I am not Superwoman. Like, my brain is fogged most of the time. Like, I have, like, I feel like I'm an airhead most of the time. Like I got brains, but at the same time, like, I don't remember everything, and I'm not trying to remember everything. Like, I got things going on at home. I got things to do at home. I got thinking about, when I'm at work, I like to keep it just with work and not really, like, bring outside stuff, and same when I'm home. But sometimes things are going on and it's in your brain and you can't do anything about it. So just try to stay organized with that. But I was gonna say something else, like, kind of important. Oh, back to the rapid response and the code blue. My first code blue was actually recently, like, that with my own patient. Like, there's been, like, my coworkers, when I've been working, they've called code blues, and I'm always, like, in the front. Like, I like to, even when I feel like I don't know what I'm doing, I do know what I'm doing, but at the same time, it feels like I don't, because it's so stressful sometimes, having to deal with the code blue and everything's, like, all over the place. But I have found myself to be very responsive to when, like, my coworkers need help, and because they've been the same way. But even if, like, if it's somebody that I have not worked with, like, if they need something, like, I feel like I'm there, or I check on their patients too. Like, it's not just like, oh, I'm gonna check on my patients. I check on their patients too. And then if I feel like something is kind of like, if I walk by the room, I like to check on the patient. If the door's closed, well, I'm not gonna open it. But if I feel like, oh, hey, you're, like, if I go to the telemetry monitors, and we have a tele monitor anyway, so there's a person who tells us, like, so it's somebody who's, sorry, I'm getting off topic. Anyways, I'll come back, I'll circle around. But we have a tele monitor tech It's a person who sits in front of the telemonitors and just basically knows the rhythms and then tells the nurse like, oh, your patient's heart rate is, you know, decreasing or increasing, or notices the change in rhythm, and they tell us. And I think that's awesome, because we don't just rely on like what we know. Like, you know, it's somebody else that's knowledgeable in rhythms, and they tell us like, hey, I think you should go check your patient out and stuff like that, right? So, but if I happen to like notice something, I'll go tell my coworker like, hey, like the patient doesn't look right or something like that. But back to the code blues, I feel like I'm always there to help. And even if I'm scared, I push myself to like be there and do what I can, grab the glucometer to check their blood sugar, or, you know, whatever I can do to help, or like, you know, what my role is. Sometimes it's not perfect. Sometimes like it's so chaotic that you don't even know what your role is, but you look and you assess and you're like, okay, I'm taking up this role, and you kind of say it. You know, because sometimes like it is short-staffed, and you know, everybody just finds a way to help. It's but that's one of the things that we work on, you know, to try to be a little more organized and stuff like that. And it's not always perfect. But my first code blue, this patient, you know, had the patient was there for like COPD, asthma, like shortness of breath, right? So the patient I've had them for one night, and then I had them the next. The first night he was doing well. Didn't even need nasal cannula or oxygen or anything. But the next night, the patient needed oxygen. And was just kind of like, not delusional, but just kind of like, didn't seem like themselves, or didn't seem, or like was a little confused. And I was like, that's a change, right? So I let the doctor know, but I was monitoring the patient. Like the patient wasn't declining fast. But then around 1 a.m., the patient just was not breathing well. The blood pressure and the vital signs were okay, but just the O2 sat wasn't, like the patient was just like hyperventilating a little bit and stuff like that, right? So I called a rapid response. It started off as a rapid response. The patient was still alert, maybe like a little, you know, like when you're kind of like anxious, so you kind of like, not a panic attack, well, yeah, kind of close to a panic attack, and you're just kind of like, I don't know if everybody does this, but I'm sure like this patient was just like saying stuff like, I don't want to say he was completely confused, because he wasn't, he was alert, but anyways, I called a rapid response. He just did not look good. Like something just did not feel right. And it's very important to go with your gut too, like, because, you know, I feel like nursing school doesn't really prepare you for a lot of the situations, but you know your baselines and like your basic information and shit like that, you know. But you know, you throughout the shift you kind of get to know the patient, you read up on the notes and stuff like that and how they've been doing, so you kind of know the patient and if they've been changing. Like you should be aware of these changes, because if you're like doing what you have to do, like you would be aware of the changes, you know. And even if the patient is like okay and like alert and oriented ×4, and the patient can walk and he seems fine, like patient's condition can change. And not to say that you need to hover over them, but you know, check on your patients. Even if they're sleeping, like go by and like, just check on them, you know, stuff like that. But anyways, so I called the rapid response, and the patient, the vital signs were okay. So I had suggested that maybe because the patient was just like, I just felt like something in my gut tell me like the patient was not okay. So I suggested to the doctors that were, you know, there, that respond to, you know, rapid responses and code blues, that were there that night. I suggested like maybe the patient go to DOU, you know, which is a higher level of care. They kind of monitor a little closer, but in their opinion, they thought that the patient was fine. You know, just keep monitoring and the patient will be okay. And I was like, nah, like something was just telling me no, right? But I pushed and I pushed, and I had another nurse also who was kind of like a resource, like charge nurse, you know, push too, but I mean, there's just so much that we can do. Anyways, because the patient, I don't know, I just had like a feeling, the other nurse had a feeling too, but the patient's vital signs were okay. So I guess they went based off of that. Anyways, the patient was trying to get sleep. He was like in and out of sleep, just not very comfortable, very short of breath, and just but in the morning time around, it was close to change of shift, and the patient was sitting in his chair in the room, and then all of a sudden I was passing by. I was about to give a report to somebody, and he called me in because he wasn't feeling well. And he got up from the chair, and he sat down on the table, he sat down on the edge of the bed, and he's like, I'm not feeling well. He said, I'm not feeling too good, something like that. And his eyes rolled back, and he just like got a little stiff a little bit. His eyes rolled back, and he like just collapsed. But he collapsed on like, his head landed on the feet side of the bed, and his feet were on the side where the head should have been, kind of like he just like fell back in front of my eyes. And this is like shift report time, so I was in there, and the unit was so loud because, you know, from night to morning, like everybody's coming in, they're getting ready to bring in like new blankets and like new linen, and just everything's getting restocked. Everybody's coming in basically. And I panicked. Not panicked, but like everything just like tunnel vision, and like I lost my hearing kind of. So I guess one of my coworkers during night shift saw me, that I panicked as soon as he hit the bed. Like he just fell on the bed, and the first thing that I could do was like look at him to see if his chest was rising and falling. He was not breathing. And then I felt for a pulse. No freaking pulse. And you know, sometimes when you panic, you check stuff fast. But I kind of like double checked, and I was like, no, like there's no pulse. And so I didn't see when my coworker came in, but she came in, and she's like, I could see her, but it was like slow motion. Like I can see her, but I couldn't hear her. So she was at the side of me, on the feet side. I was at the head side. And she's like start CPR. But I can see her mouth moving, but I couldn't hear her, and like I wasn't even thinking like start CPR. But when it's somebody else's patient, like I'm on top of it. And this time that it was my patient, and the time that it was, like I was just like caught off guard. It just happened so fast, I guess, that I just kind of like went numb. And I just could not believe, because I wouldn't think that he would code. I just thought that maybe he needed a little more like monitoring, but not code. So he just basically died in front of me. And so she like kind of like bumped me out of the way, my coworker, because she shouted it 2 times, but I couldn't hear. Like I could hear her, but at the same time it was muffled, and I couldn't hear what she said. But I know she was yelling at me, like not to me. Like, she was yelling at like start CPR, but like I don't know why I didn't even like think like, oh, start CPR now, like now. So she just kind of like, she's smaller than me, so she kind of like went in front of me and she started compressing him, and I was like, oh, you dumb, like why didn't you do that? Like this is like within like seconds, like just like within the second, like so fast that it happened. She started compressing, and I feel like before that though, because while I was checking his pulse, like I was yelling because I couldn't get to the code blue button, because it was on the opposite side of the bed. I was yelling at the top of my lungs, like, I need help in room so and so, I need help in room so and so, right? And it's so loud that nobody could hear me. But then the coworker came in, like this just happened so fast. She came in and she was yelling like, sorry, do you feel a pulse? No, like I don't know, like I heard and then I didn't hear at the same time. Anyways, point is, we started CPR. She started CPR, and he's just a big guy, so it's like, and she's small, and it was effective, but like we needed somebody big. I'm yelling. So then the charge nurse for day shift comes in, and we're trying to, you know, she's trying to assess what's going on. Why is he on this side of the bed? I was like, this is just how it happened. No time to talk about that. You know, we need to like compress him, straighten out the bed. We straightened him out. Then one of my coworkers is a big guy. He's a big guy and like strong. So he came in and he started pumping, like, you know, giving, you know, his CPR is on point. And I'm like, okay, thank you. I get to do this. Okay, the doctors like flooded in, and then, you know, other people from the, you know, Code Blue, you know, the response to that came in, and they're like, who's the nurse? I was the nurse. I have my brain, so I'm not even tripping. I'm not even stressed out about like, why is the patient here? I have everything on my brain. This is the patient's name, age, all the information. So we were able to bring him back within 2 minutes. It just ever happened so fast. But we brought him back within 2 minutes. And they were able to take him to DOU. But I feel like they should have taken him the first time. Anyways, that's like a different whole ass story. But you know, like yeah, anyways. That's my first Code Blue story. Within the year of me being a tele nurse. It wasn't my first Code Blue experience, but yeah. Anyways, this video is so long and I feel like I'm back. Anyways, but yeah, my first year as an RN, I've learned a lot. I still do not want to talk about like not my review, but you know, like I don't want to talk about the hospital and stuff like that because it's not time. You know, I'm still there, and you know, plus I don't want to bash anybody or like how it is. But I have learned a lot. A lot of things have happened, but like those are things that I cannot talk about. But definitely learning how to prioritize has been like the main thing this whole year. Now I feel like even if like a patient is critical, like I can catch up really quick with my charting and everything that I have to do, even if things, it's not like a routine, because not every day is the same thing. You know, you get patients with different diseases, but it's mostly the same thing. You know, diabetes and kidney, you know, renal failure and stuff like that is usually the same, but then occasionally you'll get something different. You deal with G tubes, like you know, G tubes, and G tubes in the nose. It's just a lot of wounds. There's a lot of wounds. Oh my gosh. I've cleaned wounds that like, you know, in nursing school, like nursing school does not prepare you like basic information to pass the NCLEX, but like nursing school, I feel like did not prepare me. Just like to know basic information on like certain diseases, but like, damn, like I was not a CNA before. I was not an LVN. I had no prior history in working in the hospital, you know. And you know, in nursing school, like you learn about pressure ulcers and stuff like that. So you think like, okay, a pressure ulcer is like, you know, what's the common, you know, in the butt area, you get like a pressure ulcer, and you know, the depth, there's different like, you know, depths to it, or like how the, you know, degrees to it, or not degrees, but you know, like stages to a pressure ulcer. But never did I think that I would see wounds like I have. Like some wounds, like with certain patients, I'm like, how did that happen? Like, how did it get this bad? But damn, some patients are like really heavy. You gotta like, you know, it's a team effort. And I feel like that's something that we've always worked on. But at least like the main nurses that I've worked with throughout this whole year, like I try to schedule my, you know, my shifts with the same nurses that I've worked with. Like, not to say that I'm not willing to work with other people, but you know, you kind of, within your unit, you know, like how people work and who you like to work with the best. So I feel like I know that, right? I know what coworkers are like to work with and stuff like that. And if there's new people, you know, I like to, you know, answer their questions and be supportive. I've been preceptor within like the year. Like I've already been a preceptor like a couple of times, and they all tell me like, oh, you're so good, or like you should be charge nurse or stuff like that. And I'm like, nah. But anyways, they make me feel good. I like teaching. That's a goal of mine that I wanted to do, you know, be a preceptor, but I didn't think that it would happen too fast. But I feel like also like not a lot of people are willing. So because even though like it had been within the year, I was willing. Like I'm very willing to teach, you know, the little bit that I know or that I've picked up, you know, so far. So yeah, oh my gosh, this video is like half an hour or more. But it's just there's a lot of things to talk about. But I feel like I can make more videos and talk about specific things in depth. I know that I'm going to talk about other things related to my personal life and, you know, grieving and all that. So look out for those type of videos. I do want to do more nursing related videos because that's what my channel was about. Don't put that noise right now. I'm about to finish. Okay. So yeah, guys, like I always have said, if I forget anything, I'm sorry. You can ask in the comments below and I'll try to answer. If not, I'll make another video talking about what it's like being a telemetry nurse. I have not made a night shift video on how I work as a telemetry nurse, or anything like that. So, I don't know. There's just a lot of things that I've been wanting to talk about. I didn't know what to start with. I did want to take some time off YouTube because YouTube is a bigger platform and more people see it. I didn't want to do videos for some time. I am on Instagram and it's, you know, people that I allow to see my, you know, my life. So I feel like I am motivated and ready to start making more videos for YouTube, more specific. Can you hold off on that, please? But yeah, guys, thank you so much for listening. If you got to this point, I like to talk. There's just so much that I want to say. I know there's a lot of things that I left out, but I'll see. When I edit the video, I'm gonna be like, oh, I should have talked about this, or I should have said this, or I should have talked about this experience. Hello, and but yeah, I'll catch you guys later. See you next time. Bye.
Be your own friend, 'cause you're way too stuck in your head. How do you think it's gonna end? Nothing that they could do, nothing that they could say